Ladies and gentlemen, if you'll give me attention, we'll get this meeting called to order. I'll read the emergency evacuation. In the event of an emergency evacuation, an alarm will sound. Everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, please use the other stairwell. Please do not use the elevators. Once you've reached the main floor, follow the exit signs to exit the building. Quickly proceed away from the building. Please be mindful of others evacuating and of emergency vehicles. Madam Clerk, I'm going to assume you have checked the roll, and we do have a quorum.
Yes, sir.
Is there anyone in the audience who wishes to speak to items on the agenda? Seeing no hands, we will move onward. Stand for a motion to approve the minutes of March 19th. That's Ms. Birchfield, second. Ms. Crisp. Any changes, alterations? All those in favor of approving minutes, please signify by saying aye. Aye. Opposed, say nay. Now, Mr. Mann, if you will come to the podium. I understand we just got our handouts. And ladies and gentlemen, I'm going to let, if it's okay with you, since we haven't really had a chance to go over them, let Drew hit part of the highlights. And in my opinion, it'd probably be best served if we adjourn the meeting. We have another meeting scheduled for the 16th. That will give us 2 weeks to review this, go over it. Any questions we have, would you mind if we contact you, sir? No. Okay, is that good with you, Mayor? Is that good with everyone over here? Yes. Okay, Mr. Mann, if you will step to the podium.
For the committee, I apologize to the committee for the lateness of getting these. We actually finished these last night at about 8 o'clock, and then I've been in Bristol, Virginia today. The format's very similar to what you guys have seen in the past. We've updated those. Your HR department here at the county was helpful, Jody specifically, in getting us Maryville and Alcoa. When I call and try to get those, they're not real interested in talking to me, nor would, if some random person called you guys without a Freedom of Information Act, would you necessarily provide some of that. So without kind of, again, I think your chairman has made a wise decision to say, hey, give us a little bit to digest it. This is 14 pages of pretty important information. We're talking about, $18 million health plan here. And so a couple of things that we've done that I do want you to focus on. Page 2, mine is not numbered. I told them to number them. Okay. I'm going to email to the committee numbered pages with numbers, just because it's easier for me, especially for the meeting on the 16th, for me to stand up here and reference page number. So definitely need to make sure we've got those numbered for you. Is that you do have the page after the cover sheet. We'll call that page 2. You'll see there the Blount County Health Plan, Alcoa, and Maryville. We're still hoping to get a couple more that are important to you guys. I do have the TPMA, that's the municipalities, as well as our client average, as well as the Kaiser Family Foundation. You may or may not be familiar with Kaiser. They're the nation's largest nonprofit aggregator of health plan data, and it's what our folks in government in Washington use to make a lot of the decisions that they use. They use that Kaiser data. You can see on the next page your deductibles, prescription drug benefits. I'm going to skip those. Those are pretty self-explanatory. You're going to come over 3 or 4 pages, guys, to the pages that says potential areas of cost savings. That's where we get into the spousal surcharge and spousal carve-out. Okay. One thing I want to be clear, the next page says projected savings, spousal carve-out. Very important for you guys to understand this when we're talking about spousal surcharge and spousal carve-out. Spousal surcharge, I know based on the number of spouses that sign up on the plan how much revenue that's going to generate for the county. Spousal carve-out, that is an estimated of claim savings, and why that's very important is because your spouses that are left on the plan, I don't know if those are going to be the healthy ones or the sick ones. Does that make sense? And I wish I knew, but that's just not how this world works. So very important when you're looking at the spousal carve-out, if you see a number of $906,000 in annual savings, that's potential savings, okay? Be very, very important that we don't. I know what it's like when one of my employees hands me a document and I start looking on the last page and I look at the big number and go, okay, that's going to cost $1 million or it's going to save us $1 million. Well, there's more to that story than that one. I've also put in, you'll be able to see the next page that says changes in plan design. If we would go from a $250 deductible to a $500, from a $500 to a $1,000, from a $250 to a $2,000 with an HRA, you're going to see some savings columns. Those are independent of each other. We would pick one of those. You don't start adding all those together. Does that make sense? Basically, this is a buffet. This is a menu. We're going to pick. This is a la carte. We're going to pick this one, and pick this one. But if we pick all of them, we don't necessarily get to add all the numbers together. Very important, okay? I'm going to flip over a couple. I'm going to go 3. The next page I'm looking at is dual plan design. And what we've done is what we've talked to the committee about in the past is looking at the county having a health plan that has more than one option. Okay? What if our employees had a choice? What if our employees had a choice to remain on the plan they have today or to have a plan that is not quite as rich as the plan that they have today? What would that look like? And what is the financial impact on the county? We've also done that on only for new hires, okay? So all that's in here. What I would just encourage you guys to do over the next week, Jody and Dawn both know how to get a hold of me very easily. If you want to send me an email directly, they'll be happy to forward you my email or my cell phone number, totally no problem. But it may be easier for you guys because you're used to communicating with them just to send them a note. Hey, Drew's got this in here. That doesn't make sense to me. How did he arrive at that? And then ideally that'll help maybe shorten some of the questions that we may have next time. But hopefully we try to put, my goal for putting these documents together is to make it to the point where you don't have to be an insurance expert to understand this. I really want it to be pretty simple and cut to the point. So if there's no questions at this time, I'll take my seat and we can just talk about it next meeting.
Thank you very much, Mr. Mann. Ladies and gentlemen, is that good with you if we do it along this line? Because as is put forth there, you've got 14 pages and a lot to digest, and Mr. Mann has offered his services. You can contact Don or Jody if you desire to get in touch with them, or possibly they can answer your questions. Is that good with everyone? Anyone wish to speak to the items not on the agenda? Seeing none, I'll stand for motion to adjourn.
So moved.
Second. All in favor say aye. Aye. We're adjourned.